The Trump administration is making moves to limit how much money graduate students can borrow from the federal government.
The U.S. Department of Education says this is supposed to simplify the federal student loan program. Starting next summer, new grad students in professional degree programs will only be able to borrow $50,000 a year and no more than $200,000 total. Students in non-professional programs can only borrow $20,500 a year and no more than $100,000 total.
Those changes are part of President Trump's big, beautiful bill, which was signed into law back in July. But it's that distinction between professional and non-professional degrees that's really drawing controversy right now. The U.S. Department of Education still finalizing its proposed definitions. But right now, these are the programs that would be considered professional. Medicine, dentistry, pharmacy, law, even theology, the study of religion, is on this list, among with some others. These are the students that would qualify for those bigger loans. Meanwhile, nursing, secondary and special education, accounting, social work, architecture, public health, many other programs would all be considered non-professional, and that's potentially limiting graduate students from borrowing enough money to cover those advanced programs.
That is incredibly concerning to us because we want people to move through the education system, get those professional degrees, and provide those services and goods here in New Mexico.
UNM leaders say they are still working to understand the full impact on UNM students and programs, but added, we are committed to maintaining strong workforce pipelines while mitigating potential barriers for students and ensuring they can continue to access high-quality education. Now let's zero in on nursing for a moment. The U.S. Department of Education says that non-professional label is not supposed to diminish the profession and argues most graduate nursing students borrow less than that new limit. But New Mexico nursing leaders say there is a ripple effect to think about here.
We are the backbone of healthcare, right? We make up almost 60% of the healthcare workforce.
And just like any other profession, nursing has different levels. But rising up the ranks usually requires an extra degree or two.
You have to be a nurse first, and then you go back and get your master's as a nurse practitioner, or as a nurse educator or a nurse administrator.
And Jason Bloomer with the New Mexico Nurses Association says it's those higher level programs that will suffer the most from a non-professional classification and the $100,000 lifetime cap.
If a nurse practitioner or a CRNA or a nurse faculty member goes to get that education, well, what happens when we need a DNP, a doctorate of nursing practice, or that PhD?
Expert level degrees, he says, are required to teach the next generation of nurses at all levels.
If we cannot train nurse faculty, nurse practitioners, nurse researchers, then we're going to run into a larger gap of how quickly, how well prepared, and how many nurses we can actually produce in this state and across the country.
Fortunately, the state of New Mexico already has a health professional loan repayment program covering up to $25,000 in debts a year. And there's a scholarship program specifically for nursing students.
Over 1,200 healthcare professionals are receiving student debt relief through this program and have committed to practicing in the state of New Mexico.
Still, the New Mexico Nurses Association is encouraging all nurses and supporters to sign a nationwide petition to reclassify nursing as a professional program.
Nursing is a profession, and we do need to be treated as such so that we can get the same amount of education, training, and respect that our profession deserves.
The U.S. Department of Education is still finalizing that list of professional degrees, and we want to make it clear none of these changes are expected to impact undergraduate or bachelor's degree programs.
And we're going to post a link to that petition for you at KOB.com.